Great. Good morning, everyone. Welcome to UAB's Town Hall for Employees. Many of you have submitted questions already, and you're going to hear from our leadership who will try to answer those questions. Just a couple of housekeeping reminders. We are recording this session. If you'd like to go back and visit, you can go to UAB's YouTube channel, and we will have it posted there later. After we hear from leadership, we will open the floor for Q&A. And also just another reminder, if your question doesn't get answered, just keep your eye out for responses in an upcoming e-reporter. So with that being said, I'd like to introduce our president, Dr. Ray Watts.
Thank you very much. Well, it's a pleasure to be with you this morning, and we've been planning this for a number of weeks as we've been planning the continuation of our graduated return to campus. We've been gradually returning to campus based on evidence and guidance from our infectious disease and public health experts since last May. The great thing is the number of infections in Birmingham and in Alabama continue to go down, and they're at their lowest levels going back to what's comparable from last May. We want to make sure we always continue to put the health and safety of our employees and our students first. But we have a big mission to pursue every day, which everyone is important for us to be successful. This return to work transition plan is a work in progress. We are asking supervisors to work with employees in their units, and the leadership continue to get input from everyone, all of our constituents. But we're excited about the opportunity to be able to return this summer and then in full force for the fall. That's made possible because we now have over 19,000 plus of our employees vaccinated, and Dr. Nafziger will give you a more detailed update about that. And we got a lot of questions about continuing with remote versus coming back to campus, questions about vaccine and how are we going to handle safety measures. I can tell you that we planned this some weeks ago on April 7th, which is 2 days before the governor's mask mandate is set to expire unless she prolongs it. I can tell you that on campus, we're going to continue to have the compliance be at 100%, mask inside and outside. You will hear about some reduction of social distancing based on CDC guidance and our infectious disease and public health guidance from 6 feet to 3 feet. And that's with people having had a vaccine and wearing masks. So we strongly encourage everyone to be vaccinated. We know that it prevents severe illness and death. And this is not a cold or the regular flu. Over 550,000 Americans have died. Over 10,000 Alabamians have died. The excellent news is those are reducing rapidly. You hear about some states where there is an increase, where they've opened up very early and not even required or advocated strong vaccination status. But fortunately, we are in good shape. And we're going to continue this process over the coming weeks and months. And we are very excited to be back together. There may be exceptions where remote work continuing makes sense, or some hybrid form of that, but it will have to be made by the unit leadership and approved by human resources. And in the end, the Transition Back to Work Advisory Committee that is chaired by Alicia Jones and Tom Brannon is advisory. They will bring information back to us after studying our complex organization, largest employer in Alabama. So it's going to take a process, but in the end, the leadership of UAB and the leadership of the University of Alabama system, with input from all of our constituents, will make the decisions about how to continue this transition forward. So there are a number of questions submitted around this, and I hope that this provides some clarity what I can say, it's an ongoing process, and we will always keep the safety and health of our employees and our students and our patients and their families first and foremost. You'll hear a lot more content expert shortly, but I want to introduce at this time Reed Jones, who is the CEO of UAB Medicine. Reed?
Thank you, Dr. Watts. I'd like to give you an update from UAB Medicine. First of all, the University Hospital and Highlands Hospital is very full. Our faculty and our staff have been very busy. We've made a lot of progress recently with patient flow, and fortunately, because of that, we're not backed up quite as much in the ED as we were a few weeks and months back. But again, we're quite busy. We're at 95% occupancy today. We have 1,057 patients in our hospital. The number of COVID patients, fortunately, has been decreasing pretty substantially. As of yesterday, we had 67 patients in the hospital who were either COVID positive or were recovering from COVID, down quite a bit from almost 300 that we had in the hospital in the early part of January. So a lot of progress there. And also, good news, we have far fewer of our employees that are out as a result of COVID. As of yesterday, I believe we only had 5 employees that were actually out of work due to COVID. So we're very fortunate about that. We've reinstated our block time in the University Hospital ORs. That's provided some degree of structure back to our surgeons' lives, and they're very happy that we've been able to do that. They were gracious enough to allow us to discontinue block time during the height of the pandemic, and that allowed us to be more flexible with our surgery schedule, and we're able to do more cases in that structure. But now that we've been able to reinstate block time, it gives the surgeons the ability to schedule their day and be more efficient. And we're back to really our pre-COVID levels in terms of surgery, so we're happy about that. We too are finalizing our plans for our employees that will continue to work off campus. So we've had a lot of success with some of our groups that are working remotely. We've asked our managers to develop plans that will ensure that we're hitting the productivity levels that we need, but also making sure that our employees who are working off campus can still feel connected to the university and be a big part of what we're doing here. Brian Sprayberry has been leading that effort for us, and we're hopefully very close to having plans finalized for all those people that will be able to continue to work off campus. We've received a question about COVID testing prior to procedures and surgery. Will we continue that? And the answer is, for right now, yes, but we've developed put together a multidisciplinary team led by our infectious disease physicians, but many other physicians are on that team, and they're actually done a pilot in the TKC endoscopy clinic there, and we're taking a look at this and we'll be making a decision in terms of how to move forward shortly there. Also, a question about patient visitors in the room. We're following the Alabama Department of Public Health guidelines and allowing 2 family members, 2 caregivers per day in the room with a patient under normal circumstances. So also concerned about some of our visitors who aren't wearing masks. People are people, and in spite of all our efforts to educate and talk to people, we are seeing some people that are not abiding by that. So it's important that we all remind them that they must pull their mask up, they must wear their mask. It protects them, it protects our patients, and it protects our staff. So let's try to be diligent about that. On another note, our initiatives with the Alliance, with our St. Vincent's partners, it's moving along at a brisk pace. We've got a lot of groups working together to look for opportunities to do things together that hopefully will provide a better service, either administratively or help our patient flow between the organizations there. So in the not too distant future, we'll be able to report back some of the work that's been done by our task forces within the Alliance. And with that, I'll turn it over to Dr. Nafziger.
Thanks, Reed. Well, good morning, everybody. I'm happy to report that it is April and we are still here. So that's the great news. A lot of other good news to report this morning as well. So from the vaccination side of the house, about 80% of our employees have been vaccinated now. And that's just a huge relief to me as a leader for employee health and for our entire staff and employee health. We're so grateful that we had the opportunity to make that happen for you all. Now, we still have some people I know who are waiting on their vaccine. There's some folks who are within their 90-day window after having had an active COVID case. And we're working on getting those individuals scheduled just as quick as we can. And we know we have some people who were a little hesitant about signing up and may have wanted to wait and see what happens. So we do have a few of those folks out there. But by and large, most employees who sign up for vaccine, we're able to get you scheduled within a week. And we're happy to be able to continue to do that. Now, there may be some pockets out there. You may know of an employee in your area who's having some trouble getting scheduled, may have fallen through the cracks. If you know about those, please report those to us. We have an email account. It's employeehealth@uabmc.edu. Real easy to remember. And just let us know about those so we can work those exceptions and make sure that we get everybody vaccinated who wants to be vaccinated. We're real pleased with the function of the vaccine. Just recently, we had some studies that came out that show at the 6-month mark, the vaccine's still working. Now, a lot of people have said, hey, this vaccine is only good for 6 months. No, that's not what the studies are saying. We know that it's good for at least 6 months. It may be much longer, but we're still studying that to see how long it's going to last. So we just don't know yet, but we know it's at least 6 months. So that's very good news from those studies that we've seen. You know, the other news about vaccine is we've been able, now that we've been cleared by the Alabama Department of Public Health, we've been able to open up the individuals down to age 16 and up. So guess what? That means we were able to open up to our students, and we've begun vaccinating them this week as well. So students are signing up to be vaccinated and receiving their vaccine. Now, I know a lot of people have asked me, they've said, hey, Sarah, what about our students who live somewhere else who want to go ahead and get their first dose? But guess what? 3 weeks from now, when the second dose is due, they're going to be back home wherever they are. Well, we don't want that to be a thing to delay their vaccine. We don't want them to wait till they go home to get their first dose. They can go ahead and get their first dose with us. We'll give them a vaccine card that the CDC prints, and wherever they live, guess what? There's Pfizer vaccine sites all over the country. And there's a website called vaccinefinder.org. Those students can use that website to find their second dose if they go somewhere else. Now, certainly they're welcome to come back to us to get that second dose. We're happy to do it, especially for all our students who live locally. But we don't want this to be a barrier to students who may live somewhere else where it would be inconvenient for them to get back to us for their second dose. You know we have a lot of employees as well, and people who may not have access to technology. If you're like me, I'm sitting at my computer all day in the email, and I'm very accustomed to that, but not all of our employees, that's not part of their job, and it may not be something they're used to. So one of the things I'm going to ask you today is if you're watching this town hall, if you know of somebody in your area who may have a little bit of difficulty with technology, ask them, hey, have you signed up for vaccine? If you haven't signed up, offer to help them. See if you can help those folks in your area, managers especially. Please reach out to employees in your area and make sure that everybody has had an opportunity to sign up that wants to. We don't want that to be a barrier to anyone. So a couple more points I'll make is, we've talked a lot about vaccine, but I want to remind everybody that, we're still doing health check, and we're still taking care of people who have symptoms of COVID or who've been exposed to COVID. Now, the COVID numbers are down so much from where they were in January, and we're so grateful for that. But we still do have some COVID cases out there. We have people who are testing positive, and we have people reporting exposures. So just wanted to remind you that we're still offering testing, and we're still managing the employees who have COVID. And we want to encourage you to report through Health Check and to test through us at UAB. And the beauty of that is that way we can manage you very aggressively from the beginning. Our employee health physicians and nurses will be calling you, managing your case, getting you referred into all the wonderful resources that we have available at UAB Medicine to take care of you quickly so that we can avoid you having the terrible illness and long prolonged course that a lot of people have seen. We can get people in for monoclonal antibody treatments when they qualify, and bridge them to other care in our COVID clinics so that we can make sure our employees get taken care of very quickly with no delay. That's a service that UAB has provided for you, and we want to make sure that you access it if you need it. A lot of people have asked me about quarantining for exposures, and this is something that's a little bit different depending on where you work in the university. If you work in the medicine side in a clinical setting, if you have a COVID exposure, we don't require those employees to quarantine after an exposure because that's part of our jobs. But if you are a non-clinical person and have an exposure, you don't have to quarantine any longer if you're fully vaccinated or if you've had a COVID infection within 90 days. Now, that's a change from how this was several months ago. So that's something that's nice that our public health guidance from the Alabama Department of Public Health has allowed us to do. So that's a nice benefit of being vaccinated, is you don't have to serve those horrible quarantine periods that we all tended to detest. But people definitely, if you have symptoms of COVID, we still want you to report, still test through us. I'm going to close with one more statement, and this is something that I feel really passionately about. I mean, those of you who know me, you know, I joke around a lot, and I usually smile a good bit. But this is something I'm dead serious about, and I want you to hear what I'm saying. I know a lot of people are nervous about coming back to campus. I've heard a lot of people say, you know, I don't think it's going to be safe, and I'm really worried about it. And I want to tell you and assure you that the employee health team and me, we take your health very seriously. And I wouldn't be sitting here talking to you today and endorsing this plan for a full return to campus if I didn't feel like it was safe. We've thought through the safety guidelines. We still have a lot of safety measures in place with our masking, with cleaning, with social distancing, and we feel confident that we can do this safely. A lot of our employees on the medicine side, you know, we've been coming to work ever since COVID began, and we figured out how to do this safely. And we feel that we can do this with the entire campus. And I want to tell you that we wouldn't be sitting here talking to you about it today if we didn't feel like we could do this safely. I'm happy to take any questions that you have when we get to that question and answer session. But for now, I'm going to go ahead and turn this over to Dr. Judd. Thank you.
Thank you, Dr. Nafziger. I'm here to talk to you a little bit about the data that we look at, just a couple of slides that we typically look at in our regular COVID monitoring when we're looking at the trends and epidemiology in COVID in Birmingham. This particular one is a slide that shows the population of Alabama. We have about 5 million people in the state. So on the left, the axis takes you up to the total population of Alabama. And this would be the number of people that have immunity in Alabama based on whether or not they've had a positive test for COVID, whether or not they have immunity to COVID but never had a positive test. These could be asymptomatic individuals, individuals that didn't have access to testing, or other groups that just weren't tested. And then in the yellow at the top, that's the vaccinated population. Now, there are a couple of assumptions that go into this. These calculations basically are the calculations we would look at for herd immunity. You've probably read about that in the media. Herd immunity is the amount of immunity we need in the population in order to stop a virus or a bacteria from spreading. This number varies wildly for various bacteria and viruses. For COVID, most scientists guess that that's about 70% of the population. To be conservative, we looked at 72% of the population, which is 3.5 million Alabamans need to have the vaccine. So that's that magic number that we're hoping to get to. And there are a lot of assumptions that have to go into this. In particular, that untested group that has immunity, there are some assumptions we have to make. We're guessing there are about 3 to 5 folks that are asymptomatic or never been tested for every one that was tested. We're also guessing that the immunity from those folks doesn't last as long. So you can see kind of the vaccinated group starts gobbling up that untested group, and they take over as the more and more folks get vaccinated. So this is a very conservative estimate, but it looks like we could reach some level of population immunity that provides a real slowdown of the virus as late as early fall, as early as probably right now, which I'll show you on the next slide why it could be as early as right now. A couple of things have to happen in order for us to realize this level of 70% immunity. The first is we need to get clearance for 12 to 15-year-olds. And that's because I'm also assuming that only 70% of the population will seek the vaccine. That's pretty high. We're gonna have to do a lot of work on the public health end to get 70% interested. While the UAB employees may be model citizens and jumping out to get vaccines, not everybody in the community is. So we're gonna have to work to get to that 70% number. And a key part of that are the 12 to 15-year-olds. And it does look like the Pfizer vaccine is very effective in 12 to 15-year-olds based on studies that came out last week. It also assumes that the vaccine will slow the spread of variants. We've got good data on this from Israel to indicate that that is probably the case. And it assumes that we have enough vaccine to continue to maintain the weekly pace that the state is hitting right now, which that appears to be a safe assumption, if not more supply of vaccine. And lastly, it assumes that vaccine immunity is robust and lasts about 1 year. We don't have data to support 1 year yet. We know it's robust through 6 months. We hope it's robust through at least a year. But basically what would happen if it's only effective for a year, we'd have to continue to revaccinate people. About 290,000 people a month would need to be revaccinated, similar to what we do for influenza. So this is something we're very familiar with in public health. Herd immunity is not something you can measure. You can measure the total number of people that have received a vaccine, but measuring people that have immunity that weren't vaccinated is tricky. So what we actually look for instead, we look at community case trends. And these two figures are statewide on the left, cases by age group, and then on the right, the positivity rate for asymptomatic and symptomatic students here at UAB, so our local data. Couple of things, if we start with the cases by age group, you'll see that in the summer, we had a pretty big spike in terms of cases per week. That solid green line, those are the 18 to 27-year-olds, and they represent the large proportion of undergraduate and graduate students. You can see that for the most part, in that those early outbreaks we had last summer and this fall, it was really driven by that particular age group. But as the fall wore on, all age groups started to increase in terms of the number of COVID cases that we saw. After we hit December and early January, you see a rapid drop off of cases. This could happen for a lot of reasons. People are no longer getting together for the holidays. People have changed their behavior, or we're reaching some level of population immunity that's allowing the virus to slow in terms of how quickly it spreads. That is quite possible given the number of COVID cases that we've seen here at UAB. We're going to continue to monitor these data trends. Obviously, there was a spike up here in February, but you'll notice that it spiked up and came right back down, which again, from an epidemiologic standpoint, indicates that there's enough immunity that it really suppresses the virus and doesn't allow it to take off. You'll notice I haven't used any words that indicate this virus is going away, that it will be eradicated, that we'll never see it. We will likely continue to monitor cases as a public health community for the foreseeable future. Here at UAB, our student cases mirror exactly what we see statewide in Alabama, higher rates in January that really plummet as we hit February and March. So again, indicating that we're seeing less spread. It could be a change in human behavior that is why you're seeing this decrease in cases. But I don't know about what you all are seeing in the community. I'm actually seeing people get a little more comfortable. I'm seeing more people out in restaurants. So it would be unlikely that a change in human behavior is driving this decrease in cases. It would be far more likely that it's some type of a change to the overall levels of immunity in the population. And with that, I will pass it off to Alicia.
Great. Thank you, Dr. Judd. I appreciate all of that good information. And hello, everyone. It's always a pleasure for me to have an opportunity to talk with you and hope to dispel some of the concerns that you have. As Dr. Watts mentioned, we got several questions and we reviewed all of those, and we'll try to address as many as possible, recognizing that some of those questions are very specific about your very specific situation. And in this town hall setting, we may not be able to address everyone's specific concern, but we will try to address as many of those as possible. There are a couple of key areas I want to talk about, and then I'm going to ask Tom Brannon to join me as we talk about the long-term remote task force that has been working diligently to propose a plan for long-term remote work. So first, I want to talk a little bit about the vaccines that you've heard Dr. Nafziger and Dr. Judd, as well as Dr. Watts even talk about. It is such a privilege to be a part of the UAB community of clinicians and educators and all of those that support all aspects of the mission, to have the opportunity to get the vaccine earlier than many in our community. And while, as you've heard, a significant portion of our workforce has taken advantage of that, continues to take advantage of that, there are some that are still a bit reluctant. And so as we continue to educate everyone in our workforce, I want to also make sure that we all remember to keep the UAB value of respect in full display as it relates to this. If we agree or disagree with someone's choice, here at UAB, our core value, one of our core values, is to respect that decision. And so while there may be some people who believe that, sharing their vaccine status is an invasion of their personal health information, we want to give them that space to do that. So be careful in asking those questions up to others. I know many people have volunteered that information to me because they're so excited to have that opportunity. But I do want to make certain that while that's a large portion of our population, that we also are respectful for the portion of our population that don't fall into that category. But I think the one thing that we can all do, because we all want to be safe, and that's where the core of the questions are coming from, is being safe, is continue to wear a mask, continue to maintain social distance, and remind everyone where they can get all of the information on the vaccine so that they can take it when they're ready. So I also want to talk a little bit about the reentry plan, because again, that there were lots of questions about the reentry plan, and thank you, President Watts, for pointing out that the reentry plan that was published in the e-reporter on March 26 is a continuation of the work that we have been doing that started last May, actually, May of 2020. So this is just a continuation of that. Many of the questions that I saw on the list were actually answered in the e-reporter article on March 26th. So I'll ask if we could go back and refer to that. That answered a lot of questions and concerns. But also another point I want to make everyone aware of that wasn't clearly stated in the article that may address some questions. HR is working directly with each unit and each unit's leaders and their HR representative to gather information around concerns with or plans with returning in the summer. And if there are concerns about summer return, what are those concerns? Understanding around expectations for when we go forward. And so we are looking to collect that information to further inform the long-term task force that we're working with, that Tom Brannon and I are working on. And two other points I'll make before I ask Tom to join me as we talk about the long-term task force is around safety protocols. The UAB United website is going to be the place that we can always go, all of us can go, to get the most up-to-date information on safety protocols. As we talk about safety protocols for May and beyond, many of those are in the works now, and they are not listed because the appropriate people are working on those now. But that's a place you can go and you will be able to find those. The other comment I want to make is that we have heard and feel that there is some anxiety about the return to campus from many of our faculty and staff. We care about you, we care about your health, and we care about making sure that you are safe and feel safe when you come back to campus. So I want to direct you to two resources that can help you in managing that anxiety that's associated with that. Of course, our EACC is always there to help you. But secondly, we have created in a partnership with our partners in IT and many in HR have worked closely together on this to create the Be Well app for our faculty and staff. You've heard about that for our students that they created, and it's been very well received. So we've created that same app for our faculty and staff. I think it's available now. I know there will be an e-reporter article on Friday that will provide you some additional information. But for those of you who have concerns and are stressed or feeling anxious about the return, use those resources to help you get to a place where you're feeling better about being able to return to campus. So I'll ask Tom to come in and I'll be prepared for the questions that you have coming a little later.
Thank you, Alicia. I want to start by thanking the members of the Hybrid and Remote Work Task Force for the great work they have done collecting and simulating information for our recommendation to UAB leadership. The purpose and charge of this task force was built off the supposition that there are subsets of UAB employees in category A and F that are able, from a technical, productivity, and compliance standpoint, to work remotely on a long-term basis. With this in mind, the task force was charged with developing an institutional remote work recommendation post-pandemic for these potential subsets of employees. The task force was divided into 4 subcommittees that focused on competitive advantages and disadvantages. This committee looked at strategic advantages and disadvantages from both an internal and external perspective with regard to hybrid and remote work. A committee that looked at groups A and F to identify subgroups within these that could potentially transition to hybrid or remote work successfully without creating conflicts with work group C. A technology and data governance committee that are identifying technology and data governance needs and a resource checklist that would be required for successful hybrid and remote work. And a human resource and legal considerations committee who are looking at policies and practices needed for hybrid and remote work arrangements. These committees are finalizing their recommendations now, and once we have their recommendations, a comprehensive draft recommendation will be created to share with UAB leadership and the system office. We also appreciate the feedback that was received from the managers or from the manager and employee survey, which was conducted in February, and the student survey, which is being finalized now. This information, as well as data from our reentry planning that is due April 9th, will be incorporated into the final recommendation. The goal is to have this information collected and to have a recommendation completed by the end of this month to be submitted to UAB leadership. And as a reminder, the remote work task force's role is advisory only, and any long-term telecommuting decisions at UAB, as Dr. Watts mentioned earlier, will be made at the campus and system leadership levels. Units of UAB do not have the authority to grant telecommuting arrangements independently. Alicia, did you want to add anything else?
I think you covered it all, Tom. I think that I'm sure that there, again, may be some other specific questions, but I think now we'll just pass it off to Provost Benoit.
Thank you. Like Alicia, I want to welcome you to this town hall. We're so delighted that you're here. It's so much better to have information. I think information reduces ambiguity and allows you to make some plans going forward. And so today we're trying to make sure that we're clarifying, answering your questions. You have that kind of information that you need to feel secure about coming back to campus. I want to start by talking a little bit about summer and fall operations for instruction, for classes. And in the summer, we made the announcement some time ago that we would be moving back toward in-person and online courses and returning to normal processes in terms of pass-fail, withdrawal, incompletes, other kinds of student policies. And then in the fall, we would be moving even more toward more in-person kinds of classes and the normal processes for students. One of the things, we had a really robust discussion yesterday with the Faculty Senate Executive Committee, and one of the things that came up there was, how do we use what we learned during the pandemic and the use of technology in our classrooms to help us innovate going forward? And I want to thank publicly both eLearning, Pam Postian is on this call, and Scott Phillips and the Center for Teaching and Learning, that they helped us see that there were many new opportunities. We want to make sure we continue to pursue those as we go forward. I know that there are some planned workshops that will be hosted at the Center for Teaching and Learning that will help people really think through how they might innovate in their classrooms now that they have some additional skills that are part of their skill set. For summer, we have a couple of changes that will occur, and we've referred to them before. One is that we're moving from the 6 feet social distancing to a 3 feet social distancing. That will be in the classroom. It will be in public areas. One of the questions I saw that was in the chat is, why would you go to 3 feet? Isn't it safer to be at 6 feet? So there are a couple of things that influence this decision. One was, particularly for classrooms, we know from the data that's been generated that COVID is not being transmitted in the classrooms. That it's mostly outside activities to the campus where those positives are occurring. Secondly, we saw from the chart that Suzanne Judge showed earlier that the positivity rates are declining significantly, which allows us to feel more comfortable with the 3 feet. And we worked very closely with our public health and infectious disease experts on this recommendation. They looked at the research, and the research, as I understand it, and we'll have, I know Dr. Irwin's on this call, it suggests that 6 feet was done out of an abundance of caution. And you've probably even seen the CDC director talk about how she believed 3 feet was adequate. So all of those went together to inform our decision of moving to 3 feet. I want to emphasize something that Dr. Nafziger said, which is that this is in light of continuing a number of other health and safety protocols. So we will continue to mask, even if the state decides that it's not going to have a mandatory mask ordinance. We will continue to observe hand hygiene. So the other kinds of safety protocols that have been in place all along, all of those will continue. And it's that combination that allows us to feel comfortable with the 3 feet. For fall, what will happen in terms of fall, in terms of social distancing and masking potentially? We continue to monitor this. In fact, we monitor every day. And if we feel comfortable that we can make another decision that might remove social distancing, we'll move in that direction. But we'll be watching very carefully the data and consulting with our experts to decide exactly what those protocols will be in the fall semester. For travel, this is another thing that we've made some new decisions on. Travel will be open for domestic travel after August 1, but we will not be doing international travel after August 1. At August 1, we'll continue to monitor the international situation. You probably read on the news, there are some countries that are currently in lockdown and seeing massive increases in cases, and we clearly don't want individuals to be traveling to those locations. And the last thing I want to highlight is commencement. Our students have wanted an in-person commencement for so long, and we now are so pleased that we will be doing an in-person commencement at Legion Field on April 30th for the graduate students, and May 1st, 2 undergraduate ceremonies. The graduates from 2020 who didn't get that experience are invited to come back. We welcome them and their families so that we can celebrate not only their incredible accomplishments in graduating, but also that we are at the point where we now feel very comfortable having an in-person ceremony that can be masked, that can be using social distancing, that can be safe. So we're very excited to be at this point in time. I've said at another meeting, I do see the light at the end of the tunnel, and every day that light gets a little brighter. So we're looking forward to seeing you all back. Thank you. I want to pass on now to Katie Crenshaw, who is the Chief Compliance Officer. Katie.
Thanks, Dr. Benoit. Great to be with everyone today. And a number of the points that I was planning to make have already been made by our previous speaker. So let me just bookend what Dr. Watts started with and share that, throughout this pandemic and now as we hope to emerge, UAB leadership has been making operational decisions for campus based on the evidence and the advice of our infectious disease and public health experts. Now, as we are looking at new data in terms of our community experience and our experience on campus, UAB leadership and conjunction with the UA System Health and Safety Task Force is considering our health and safety protocols. And there are really, with plans in development, just 4 things I wanted to touch on. They include UAB Health Check, active sentinel testing, events, and summer camps. I know that there were a number of questions submitted about continuing UAB Health Check. We anticipate that additional announcements will be made hopefully as early as next week about continuation of UAB Health Check. We're looking right now at certain employee work groups that will continue with a daily health check requirement. And we anticipate that for other employee work groups, that daily requirement will expire May 10th. So again, stay tuned to UAB eReporter and email announcements for how those requirements will impact you based on your situation and employee work groups. And let me reiterate too something that Dr. Nafziger said, which is even outside of a daily health check questionnaire requirement, all employees who experience COVID symptoms or have a potential exposure will continue to have support from UAB Employee Health so that they can be appropriately evaluated and referred for testing. So those resources will remain, and we'll make sure that employees are directly connected with employee health when those issues arise. Speaking of testing, again, as we move into the summer and the fall, employees will retain access to COVID testing when they have symptoms or close contact and UAB Employee Health refers them. That said, the final day for GuideSafe Active Sentinel testing, which is the institution's program for routine asymptomatic COVID testing, will be April 22nd. So please take advantage of those opportunities as they arrive in your inbox from the Team Healthy email address and the Verily system through April 22nd. We got a number of questions about campus events, and those plans continue to evolve and develop. What I will say is those standards that will be communicated will of course include masking, as others have reiterated, and appropriate distancing. But more specifically, our plans for events will address capacity and attendance limits, how we approach food and meals at those events, visitor requirements, and additional processes for obtaining the necessary approvals. Steve Murray, Melanie Martin in the Finance and Administration Office have developed web forms that will be used for campus events and allow units that are planning events to submit information about their health and safety protocols, how they plan to approach that through the summer and the fall. So more to come there. The final thing that I will mention is in relationship to summer camps. Beginning June 1st, UAB will allow summer day camps to resume on campus, and units who are sponsoring summer programming for children will be required to obtain approval from the UAB Youth Protection Office and submit information about how they will manage health and safety of participants as well as program staff. And they will be required to meet all of UAB's health and safety standards, including masking, distancing, occupancy, those sorts of things. Look for more information over the coming weeks about openings. I know especially for employees who rely on summer camps for childcare, these opportunities will be made available. HR and the Office of the President, Emily Weigel, have developed a list of resources for childcare that's available on the HR website. And hopefully maybe one of my colleagues can drop that link in the chat so that employees have that resource available to them. It currently includes childcare resources through the end of the school year, but will be updated with summer options as those programs become available, as that information becomes available. UAB's Incident Command Committee continues to meet several times a week to monitor data about UAB's experience with COVID on campus and to advise UAB leadership on strategies that will promote health and safety on campus. I would encourage everyone to stay tuned to the UA System dashboard. that's updated each Friday and is available online to all of us. Information about UAB's experience and the broader community is available there, so stay tuned. And again, others have mentioned it, but additional information will be forthcoming about our health and safety protocols and will be posted to the UAB United site. The most up-to-date information is available there. And stay tuned on Tuesdays and Fridays to the UAB Reporter, where announcements will be made. So with that, let me turn it over to Rosie, and maybe we can get to some specific questions.
Great, thank you. We do have a lot of questions coming in. I'm going to start with a few that came in that we didn't have time to address. I know that we have Greg Parsons on the call. Greg, a lot of folks are just asking, what are we doing to ensure that our facilities are safe as we come back to campus?
Thanks for the question. And I'd like to say we know more about cleaning and protocols now than we did a year ago, and still more than we did in the fall. And thanks to everyone for asking the questions and helping keep these items in focus. We intend to pursue the same cleaning in terms of the overall protocols that we've implemented, the frequently touched items. We're staying up to date with the latest information from the Centers for Disease Control. We're meeting with the Incident Command Center to kind of get an overall statement. But as far as cleaning, rest assured, we're going to continue the cleaning at the same rates that we found to be effective throughout the year so far, as well as the air systems in the buildings will continue to operate with the maximum outside air potential. And other things we'll continue to consult with the group and keep things in focus that we need to adapt and adjust as we bring more people back to the campus. So.
And just as a follow-up, Greg, we had several questions related to signage on campus. Could you talk about any adjustments that would be made to campus signage?
I think one of the things that's fairly clear is the directional signage. The one-way traffic is probably going to go away. That was implemented in a few places. You'll probably see that kind of taken up and removed. The guidance about 6 feet, I think, as the provost mentioned earlier, will be going to 3 feet. So there may be some minor modifications there. I don't think we'll have the same volume and quantity of signage that you saw before. You may see something about elevator usage. We may post some things where it could be less obvious as to what needs to be done, but we're looking at all the situations to try to provide the information to follow the best and latest guidance from our public health experts.
Thank you. And then pivoting over to the hospital side, Reed, we had a lot of questions that came in about bridges. Apparently, there are folks that would love to have bridges reopen.
Well, we would love to have them open too, particularly the bridge between the Women's and Infants Facility and Children's Hospital. We're working with Children's, have an ongoing dialogue, but until everyone gets comfortable with the need no longer to screen visitors, we're going to keep that bridge closed. But hopefully in the next few weeks or months, we'll be able to address that.
We also had a lot of questions that came in about merit and hiring freeze. So I'm just wondering, Alan Bolton, if you wanted to respond to those questions. Is that would there be a continuation? Is there any anticipation of lifting those?
Sure, glad to do that, Rosie. Thanks for the question. Related to the hiring suspension, we had made a commitment at the beginning of the fiscal year that we would evaluate that on a quarterly basis. We just finished our second quarter of the year, so we'll be pulling that data together through March to see the impact of that and communicating with the campus leadership as well as the system leadership. This is a system-wide initiative. So I will remind people that if there are essential hires or essential promotions that you feel need to occur for market-based reasons, we do have an exception process that we've had in place since the hiring suspension was launched. So please, put your justification together and forward that through the normal exception process. In terms of merit, we are hopeful for a merit plan for the upcoming fiscal year, but we are pulling our budget together. As most of us are painfully aware, it is budget season at UAB right now. So we are assembling that information, and we are anxiously awaiting what the state will do, and are looking at what tuition may look like for next year as well, because we've got to have the revenue to support any increase in expense on that side. So stay tuned, but you'll probably hear about merit proposals sometime in the early to midsummer.
Individual asks, what do I do if my manager is making me come back and I want flexibility? Alicia?
And Rosie, I'm going to ask the second part of the question. I didn't get, if my manager's making me come back and.
Yes, somebody wants to know, what do I do if my managers make me come back, but I want flexibility?
Okay. Well, one, I think there should continue to be conversations with the manager around what the flexibility request is. And if they can make it, we encourage flexibility. But also we recognize that there may be sometimes, based on the business need, that individual requests may not be able to be accommodated. So if you've had those conversations and there's a need to have further discussions, reach out to your HR partner, HR consultant. We'll be able to help facilitate that conversation. But I also want to be clear that if the manager is not able to make that accommodation for business purposes based on the needs of the organization, of the department, we may not be able to just totally ensure that everyone will get the flexibility that they're asking, but we will certainly try.
And then just as a follow-up, specifically, people are citing childcare issues this summer. So what's your perspective on flexibility this summer with childcare?
Well, and I mentioned that with the HR dashboard, we're gathering information about the summer. And if there are specific needs required for summer as it relates to work arrangements, and childcare and other family obligations are one of the options there. So I would say talk with your supervisor, your HR liaison, to make sure that that's properly reflected in the HR dashboard and the information that's being gathered.
Thank you. I think this question, or this set of questions, is for like Dr. Nafziger and maybe Dr. Irwin and Dr. Judd. We've had a lot of questions come in about the concern about new variants and what's UAB doing to track those variants. People feel like it's unsafe with those variants out there. So if one of you could help answer that question, I think that we would appreciate it.
Yeah, absolutely. We are tracking them. Just so everyone knows, we have a weekly meeting every week where we do track them, and we track the data in other countries. I did post in a separate link data from Israel, which is the strongest. Israel has the most aggressive vaccination campaign in the world right now. And even though there were documented instances of South African, Brazilian, and UK variants in Israel, they didn't have huge case spikes. It's not what we call causal, it's observational. But the data in Israel do look good in terms of the vaccines working to stop the spread of variants.
Dr. Nafziger or Dr. Irwin, did you want to follow up with anything?
I think Dr. Judd stated that very well. The only thing I could add is that at UAB Hospital, we do test for the variants in our labs on a limited basis. It's only on select samples and then some random sampling. And we have identified a few of the variants. You've seen that we've published some of that information in local media, but frankly, we don't test every sample for them. There's just no reason to do that because it doesn't change anything that we're doing with our strategies for safety right now. We know that the variants are coming. There's nothing that we can do right now to stop that. We know they're going to be in our area, but the reassuring news is just what Dr. Judd just stated. It looks like the vaccines are working on the variants, so we're very happy to know that. Dr. Irwin may have something else to add.
Okay. the mainstay question is parking. So unfortunately, we don't have Andre here, but Greg, I'll pass it over to you if you just want to say a few words there. We've had a few questions about people saying they've given up their parking space, and you know what should they do in order to get back to campus? Where are they going to park?
Yeah, thanks, Rosie. We're going to transition back and move some of the people back where their previous parking spaces were. So if they were previously in a lot not as close to, for instance, their place of work, they may move back. And if they gave up their parking pass or permit, they'll need to get in touch with UAB Transportation Services to re-implement that. And Transportation Services will be happy to assist them with finding the best option and best choice. So I'll put the website in the chat if anybody needs to look at that.
We are getting close on time here, and I just we have had a lot of questions come in. I haven't had time to go through each one of them. So just wanting to ask the panelists, was there a question that was dropped in the Q&A that you want to address for the audience, for the attendees? Anything pressing?
So the one thing I wanted to add was about the upcoming Wellness Day. So a week from today, the 14th, for many of our faculty and staff, there are some limitations on that. So work group C is not included. People who have essential services jobs are not included, but others are, where we have been able to give an extra holiday to really focus on having some downtime and relaxing and being stress-free for that time period. And so I am really glad about that. I did notice that one of the questions that appeared is, why aren't we having more wellness days? And one of the difficulties for us is that wellness days, particularly for faculty, are driven largely by our accreditation rules. And so anytime we give an additional day, we have to make sure that we are abiding by the number of seat hours, instructional time that our faculty and our staff are providing. And so that really is a driver. We feel very fortunate to have been able to place 2 of those days into the schedule. And I would remind faculty again that this is an opportunity while we need to have students doing some instructional activity. It needs to be not a high stakes activity. It needs to be a fairly modest activity so that people really can use that time to relax and have a stress-free day. I know in the e-reporter, there was a nice piece about some ideas about things that people could do during wellness days. You know, here's a great opportunity with the wonderful weather to get outside and to spend time with your family. And so I think I see this as a gift. It's a really nice way for us to acknowledge that there's still a lot of anxiety and angst. And here's some time to really give yourself a chance to reduce that stress.
Thank you.
Only other question I saw, Rosie, that was pretty consistent was on our long-term monitoring. And I just want to let folks know that every day we actually look at the cases. Every single day, our committee looks at the number of cases in our community. Every week we look at trends across UAB, the state and nationally. So we aren't going to let the ball drop just because we're opening up. We're going to continue to watch very carefully to see what's happening in terms of cases that are happening around us.
Great,
Rosie, I'd like to make one clarifying comment about research labs, and that is that we are recognizing how careful we've been through the year. Now, the requirement is, as we've said, you must wear a mask in a research lab in any situation, but the social distancing is strongly encouraged but not required. So the 3 feet that we've talked about for classrooms and other spaces is not a hard set requirement in the labs. We recognize that a lot of lab activities don't allow for that, but as much as possible, social distancing and continue with hand hygiene and so forth. If you're involved with undergraduates, particularly, or with high school students, they need to go, the high school students, through the youth protection program. And if there are situations where you've got to have lab members clustered around, there is an exception process that can be brought into play.
Thank you, Chris. We are nearly out of time, so I want to pass it over to Dr. Watts for some closing remarks.
Well, thank you very much. I want to thank all of our speakers for really providing your expertise about questions that many of our employees and faculty have. I hope that as you've listened, you recognize that we are being as transparent and clear as possible. There are things that can't be decided yet, but as Dr. Judd said, we follow the data and we will make the best decisions for the health and safety of the UAB community. And we are working hard through our vaccination sites to help get the community vaccinated. And so that's been a labor of love, really. And we are thankful that we have the resources and people to do that. There are opportunities for folks to volunteer to help with that. And so if you're interested in that, you could reach out to the vaccine team. And I'm sure employee health could help guide you to an opportunity to volunteer and help. I also want to say thanks to all of our employees, and it's been quite a year, and we have handled it as well as any campus in America. And we based our decisions on evidence, and we're thankful that we have such great experts at UAB who don't only advise us, but they advise the system, our other campuses. They advise the state, and they make sure that we are as safe as possible. So thanks to everyone for all your contributions, and look forward to seeing one another in person more in the coming weeks. Dr. Benoit.
I want to reiterate what Dr. Watts said. Thank you so much for everything that you've done, and be encouraged. We're in a good place now and getting to a better place all the time. So we're so excited to see you. We're so excited to get back to some sense of normalcy.
Thank you.
Mhm.